my project, a multimodal approach to monitoring the state of microvasculature in patients with psoriasis in the course of treatment. Increasing the efficiency of therapy and achieving stable remission of psoriasis has been and remains an acute and not fully resolved problem in the world and domestic dermatology. The aim of my research is to evaluate the efficiency of treatment of patients with psoriasis by applying a multimodal approach. We show the possibility of using a multimodal approach in the clinical practice of psoriasis treatment, including three optical non-invasive technologies: laser Doppler flowmetry, laser speckle contrast imaging, and video capillaroscopy. The introduction of the multimodal approach to clinical practice will allow to evaluate the efficiency of treatment and adjust it, depending on the individual characteristics of the system. Thus, this approach will make it possible to individualize the treatment of patients with psoriasis. At the first stage of the study, laser Doppler flowmetry revealed higher values of blood perfusion on psoriatic plaque as compared to the intact tissue, as well as higher values of amplitudes of cardiac oscillations. This can indicate an active influx of arterial blood into the microvasculature. The data are confirmed by the results obtained by the laser speckle contrast imaging method, which showed that before the start of the conservative therapy, the average contrast value in the area of psoriatic plaque was lower than in the intact tissue, which indicate a higher level of blood supply to this area. Also, the video capillaroscopy method confirmed that the number of capillaries in the affected area is several times greater than their number on intact tissue. At the final stage of treatment, there was a decrease in the values of the microcirculation index and a decrease in the amplitudes of cardiac oscillations in the affected area in intact tissue. There was a tendency to the decrease in the number of visualization capillary loops per unit area and an increase in contrast in both psoriatic and intact tissue, relative to the previous stages of the study, which may indirectly indicate a decrease in the level of blood supply in the study area and indicate a decrease in the activity of inflammatory processes. The results obtained allow us to conclude that the proposed approach expands the possibility of obtaining clinically significant information about microvascular changes in patients with psoriasis and allows to monitor the efficiency of therapy with the possibility of its corrections.